The government is increasing its investigation into payments made under federal health care programs because it's seen a marked increase in improper coding and exaggerated coding. In fiscal year 2011, the government invested approximately $600 million in audits and investigations of healthcare payments. The result was a recoupment of approximately $4 billion, which made the investment a very good one for the government. The government is performing most of its audits through third-party companies that perform CERT audits and RAC audits. A CERT audit is when the government hires a company to audit a third-party intermediary that has been contracted by Medicare or Medicaid to process and pay claims for the government. In the instance of a RAC audit, the government goes and directly audits the provider themselves. There's an added motivation for the RAC auditors to discover improper billing and coding and recoup money for the government, because they get to keep between 9.5% and 12% of the money that they obtain for the government as a result of the audit. The government is taking a close look at ancillary services provided by physicians and groups because it sees the potential for the physician or the group to earn an unfair profit or engage in fraudulent conduct by referring more referrals to himself than are actually needed. Audits and investigations are very expensive for providers. One way a provider can protect himself or defray the cost and heartache of participating in these procedures is to obtain an insurance policy such as the MediGuard Plus insurance policy. Coding and billing problems can also lead to problems with private insurance payers. Private insurance payers are dealing with a limited number of healthcare dollars, and they need to use them as efficiently as possible. If a provider gets a reputation with a third-party payer for submitting claims that are not properly coded, the provider is likely to deny more claims than it should deny or improperly downcode claims from providers.